Hello, my name is Liana Tardatian, and today I will show how to take a blood pressure with the help of a manual sphygmomanometer. So I am using manual sphygmomanometer and also the stethoscope. And this is my patient, my husband. Hi Ruben, my name is Liana, and I will check your blood pressure.
Okay.
Did you exercise recently, or smoke, or drink a coffee?
No.
Okay, so we have to check if the patient had any physical exertion, because it may change the blood pressure and it will be incorrect. So in that case, a patient has to calm down during 30 minutes, and then we can check blood pressure. Then I asked the patient about his blood pressure. Regular, usual numbers, around 130 over 80 and 90 millimeters mercury. So I am sanitizing my hands. I checked the number of patient blood pressure, because now I know how much I should inflate the pressure. It should be 30-40 millimeters more. So I should inflate the air in the cuff around 160-170 millimeter mercury. So for that reason, arm of my patient should be at the level of the heart, and his legs are uncrossed to correct the data. Which arm do you prefer? Left is good. So we have to check, is there any IV site or any surgical wound, mastectomy. If there is some problem on the arm, we use another arm. So I am checking. I have to find brachial artery, and it should be in the area of elbow, a little bit in the distal part of the, a little bit high. It's over here, and on the our cuff there is an arrow showing where should be our pulse. So I put this cuff just over here, and the arrow should be 2.5 inches above the arm, and the cuff should be not too tight, not too loosen. I am checking by putting my 2 fingers, and it's good enough because it's not too tight, they can pass through, and it's not loosen. So then I am finding the brachial artery. I put my fingers the way they are not closing the bell, and now I can hear. I listen to artery. After finding artery, I am closing the valve on the flutter, and I am flatting (160, 170), and then I am very slowly 2-3 millimeter mercury with speed 2-3 millimeter mercury. I am loosening the valve. Now I hear the pulse. It's 120. It's systolic pulse. I can hear the sounds. And now this is silent, around 90. So the patient's blood pressure is 120 over 90 millimeter mercury. So the blood pressure is 120 over 90. Thank you.